Hello everyone, my name is Christoph Römmele. I'm from the Department of Gastroenterology of the University Hospital of Augsburg, and today I would like to briefly present our study entitled Single-Use versus Reusable Gastroscopes for the Initial Assessment of Patients with Upper GI Bleeding, a prospective randomized non-inferiority trial. So why did we perform this study? As you all know, over the last 20 years, single-use endoscopic devices have been introduced into the market, and nowadays we lack reusable instruments. We mostly use only single-use devices. And now in the last 5 years, also single-use endoscopes have been introduced into the market, but we do not have any real data concerning the performance. We don't have any high quality randomized control trials, especially on the issue of single-use gastroscopes. And therefore, we wanted to elevate these gastroscopes in a clearly defined clinical niche, namely in patients requiring emergency gastroscopy due to suspected upper GI bleeding, because we thought that this might be a good clinical use case for single-use devices due to logistic reasons. So what did we find out within the study? We performed 74 gastroscopies with a single-use device and 74 procedures with a newly reusable gastroscope. The patients had a median classical Blatchford score of 12, so it was quite a sick population. And the primary endpoint was the complete and adequate assessment of the upper GI tract, and it was non-inferior. So in both groups we have a rate of 97 to 96%. And in the secondary endpoints, we could demonstrate that we detected fewer bleeding sites with a single-use gastroscopes. However, the rate of bleeding lesions which required then endoscopic intervention did not differ between the two groups. It was around about 50%, but we could show a trend towards less effective therapeutic performance with these single-use gastroscopes. Although the study was not powered to assess these endpoints. We had 5 crossovers from single-use to reusable gastroscopes due to poor visibility in 2 cases, and in 2 cases due to a failed therapeutic intervention. And the overall user experience was rated worse with single-use gastroscopes compared to the reusable gastroscopes. So to shortly conclude, single-use gastroscopes are inferior in the overall performance compared with new reusable gastroscopes, even though the primary endpoint within our study was non-inferior. Nevertheless, single-use gastroscopes were able to detect clinical relevant bleeding sites and in most cases seem to allow an effective endoscopic treatment. And from my personal perspective, particularly also with regard to sustainability, I think single-use devices should not be used on a routine basis. However, there are specific niches where we can use single-use endoscopes, mainly for logistic reasons. And what we have all to keep in mind is that at present we have no reliable clinical data on endoscope or better gastroscope associated infections. So therefore, I really think mostly logistic reasons can be the reason to go for single-use endoscopes. And also in centers with very low procedure numbers, the evidence suggests that single-use gastroscopes may actually be more sustainable than reusable gastroscopes. So this was our study in a real brief form, and yeah, thank you very much for your attention.